Dr. Chantal Caro. I'm an assistant professor at UNCG. I'm in the gerontology program. And my session for this afternoon is titled, What Can We Do Now? Healthy Aging for Our Future. So I just want to thank you all. I'm really interested and really excited to be here to talk about aging, which is certainly my passion, and more specifically, healthy aging for today. Has anyone here heard of the concepts of, might be a little bit of a refresher, and then new stuff, which is great. So I'm going to talk about both of those concepts that really embody a holistic approach to aging as a whole, and then hopefully tying that in with some brainstorming from all of you, and I have some tips myself as to ways and strategies we can really strive for healthy aging. So this might sound like a super simplistic trick question, but I promise you I'm offering no tricks today. But I want to know, what do you think, or when do you think aging starts? I'm offering no tricks today, but I want to know, what do you think, or when do you think aging starts? At birth? Got a lot of at births? Great. I mean, you all are, why am I even here? You don't even need my presentation. So yes, many people will say at birth. Many people will even go a step further than that and say conception. In general, the really key thing that I think we can all agree with today as well is that we are all in this room aging. We are here, we are alive, we are aging. I want to give us this reminder because oftentimes aging in relation to our health can be seen as an afterthought. We're not really picking up on it. And it's not until midlife or later life when the knee starts hurting, the back starts going, the gray hair, although I've had gray hair since I was 9, so that doesn't count for me. But the gray hair, randomly out of nowhere, you're in your mid-20s, you get allergies. And now you're like, what is going on? And it is those kind of situations where we're like, I'm getting older, and it's not just a number. Things are actually happening. So when we're thinking about aging, and when we try to define healthy aging, you're going to hear and probably find a lot of different definitions. Generally, the definition that you'll most likely come across is a person's ability to maintain function. Oftentimes that function is related to or focusing on physical ability, so the ability to walk, the ability to move on your own. I would argue we can add to that cognitive function as well as the maintenance of social relationships, so that we can look at all of those things as it relates to healthy aging. And one way for us to look at that and that kind of holistic view is through the life course perspective. Oh, I missed my fun pictures, my bad. Anyway. All right. So the life course perspective allows us to use a framework that considers how life events, experiences we have, social climate that we grow up in, demographics like our age, our gender, our ethnicity, how all of those factors can impact a person's life throughout their life course. So that it's not that just because you were born in Greensboro we can't think about how that doesn't impact you if you've stayed in Greensboro your whole life, or if you were born in Greensboro but you moved overseas and then came back to the U.S. All of those things matter as we age. A couple of components of the life course perspective that I think is really easy for people to relate to are things that we call transitions or turning points. And these are points in our life that mark specific events. And these tend to be pretty kind of monumental or what we might consider milestone events. So think about like graduating from school, or for the first time experiencing the death of a loved one. Given those two examples, what other kind of turning points or transitions have you already experienced in your lifetime thus far, or that you can think of? Birth of children, excellent. getting married. New job. What was over here? Same thing, new job. Yeah, I remember my first paycheck when all the money was gone. That was a hard one to the heart right there. I'll take one more example. I'm a teacher at heart. Gotta drag it out of you. I'll offer my own since I have, well, I did get two, but I'll offer my own. I am of Cuban heritage. My mother's Cuban. And so for me, it was a quinceañera, or in American culture would be a sweet 16. And so that was kind of a milestone of childhood into young womanhood. So we can think of these kind of turning points in life events as we age. And what I want us to also remember is that all of these different events, milestones, experience, they are also shaped by these kind of more micro level factors that we might not completely pay attention to all the time if everything is kind of going okay, which are these biological, psychological, and social factors that happen throughout our life. When we're also thinking about the life course perspective, I want us to think about context. So remember I gave you the example of like living here, or being born here in Greensboro and moving elsewhere? Context in the life course perspective looks at historical events, it looks at our environment, it looks at our social political climate. So when we're thinking about this kind of larger context that we are in as we get older, we can think of things like any experiences with war. I mean, that's a big one, but there's that one. I remember growing up, my mother's a baker, and so Y2K was a pretty big, scary thing in my household. It was like, what's going to happen in the turn of the century? What are we going to do? The computers are going to stop working. That was a huge thing for my household. Another thing which I think is really interesting and both historic and current is the passing and then now most recent overturning of Roe v. Wade. That was a historical political event when it happened in the 70s, and now it has become another historical event now in the 2020s. I promise I know what year it is. So those are some examples of these larger environmental things that are happening or cultural things that are happening as we age as well. What I want us to remember is that while this depiction looks really linear, how we traverse our life course isn't always linear. While we we set examples of a first job, of children, of marriage, those don't always go in that traditional line that we kind of expect or think of. And so what I want us to remember that is, because it is not linear, it means that we still have choice. We still have choice, we still have the ability to garner support from others, and those choices and supports can negatively and positively impact our health as we age. So the biopsychosocial model helps us understand some of those choices and those direct and indirect impacts as it relates to our health. The biopsychosocial model or biopsychosocial framework helps us, again, continue to view aging through a more holistic lens. This was not first introduced in the field of gerontology, was actually first introduced in the field of medicine, on how we can take a better approach to caring for individuals as it relates to Western medicine in particular. What we see from this diagram, though, is that each of these factors, biological, psychological, and social, all impact each other. So something that happens in one area of our life has an indirect or direct impact on another, and vice versa. And then all of these, similar to the life course perspective, are impacted by larger environmental, social, cultural, institutional factors wherever we live, in the society that we live in. I have the word factors listed up here. One of the ways that I like to see to actually frame this, and you'll see this in the health literature a lot, is through this idea of using capital. So biological capital, social capital, psychological capital. And why I like this is because it helps us think about how each of these areas can have different levels in our life. And so when we think about something like biological level, or biological capital, or biological factors, we're thinking about our genetics. We're thinking about our appearance. We're thinking about our sensory function. Those are some examples. Where we're thinking about psychological, we're thinking about emotion, self-esteem, coping, resiliency, personality. Those are all in the psychological. And then when we're thinking about social, we're really thinking about social network and relationship. So I want to give you an example of how we can see all of these interacting. So I'm going to take a hope and a prayer here. No one in the audience is named Jean, are they? All right, so I'm going to use Jean as my example. All right, so let's say we have Jean. Now Jean has hit the genetic jackpot. And that means in terms of their family history, Jean has no history of any type of chronic condition like diabetes, heart disease, hypertension, nothing that has come up in their family line. So we're going to assume that they're pretty good there. And so they have a relatively high level of biological capital when it comes to their physical health and chronic conditions. Now, Jean also, though, has had some challenges with depression and anxiety. So now this has kind of lowered their psychological capital just a bit because they have trouble dealing with major life transitions, have some issues dealing with coping when things change unexpectedly. So now their psychological capital just a bit lower. However, we see how this impacts Jean's physical and social health, or biological and social capital, same kind of thing, because their depression limits them from hanging out with family and friends because they choose to isolate themselves. And during this isolation, they also end up neglecting themselves through poor nutrition and engaging in sedentary behavior, so they're not really getting up and moving. So now we see how that's impacted both their biological and psychological capital as well as social capital. So you see here how one thing that we might have focused on one area of Jean's life that on the outside looked pretty positive. Great, you're going to go to the doctor every year and they're going to tell you, no chronic conditions, you're wonderful. But then all of these other factors are now impacting Jean's physical health. That example might seem pretty bleak. I promise you there is a shining light. Because research tells us that even as we get older, even as we age, we can continue to do things and engage in behaviors that aid in our health. Can I guarantee you you're going to reverse anything? I cannot. I'm also not a clinician, I'm a gerontologist, but I can't guarantee you you're going to reverse anything. I can't also guarantee you that you're absolutely going to delay the onset of anything, especially if it's a genetic condition. But what I can tell you is that the lifestyle changes and behaviors that you engage in can directly and indirectly impact other parts of your life that might give you a little bit of a cushion, that might give you that little bit of a leg up to kind of move towards that healthy aging. So what does the research support when it comes to biological factors or biological capital? So we probably already know this, you've probably heard it quite a bit, especially on TV, but physical activity has tons of positive implications for our body and our minds, even as we age. Think about things like preventing or delaying the onset of chronic conditions, particularly a lot of work on type 2 diabetes. We see physical activity benefiting depression and anxiety, so engaging in physical activity, lowering symptomology of depression and anxiety. I didn't say get rid of, but lowering symptoms, right? So making it easier for us to get day by day through. We see physical activity tied to prevention of falls, improvements in sleep. We've seen it, research shown it to be connected with cognitive function as it relates to our memory, our sensory abilities, in particular orientation. So being able to determine where you are in a specific space as it relates to something else. So we see all of those kind of benefits with physical activity in particular. I say all of that, but when somebody tells you, most likely your physician tells you to do more exercise, what is like the first thing you feel or you think? How much? That's a great one. Anything else? I'm sorry?
When? With what time?
Yeah, when? Exactly. It can be a bit overwhelming, right? Like, okay, you're telling me to do exercise, and maybe you already are doing exercise, and now he's telling you, or they are telling you to do more exercise. So I found this really interesting chart, and I'm sorry you can't see it from here, but I like this because it goes from adolescence into adulthood, and it kind of breaks down what they tell you in terms of time and how much exercise to do. In particular for older adults, they say an average about 150 minutes a week. But I wanted to suggest to you all that even if we say 150 minutes, let's just throw it out there. What can you do that you might already be doing and already be enjoying that still gets you to be physically active? Because the World Health Organization only defines physical activity as movement produced by our muscles that expends energy. So me standing up here just kind of doing this wobbling motion is physical activity. And I'll tell you, as a teacher, I'm exhausted after something like this. So whether it's really that much physical activity or not, it takes a toll, right? But think about things that you might already do in your everyday life or that you could do with your community. For example, I saw a bunch of, you saw the little kids here today, I guess there's a school here. What are you doing with kids in the neighborhood or your own grandchildren? Are you taking a walk with them? Are you playing a game with them? Are you, taking them to the store? I remember going to the store with my grandmother, and that was kind of a thing. You went to the dollar store, you got one toy, and you spent an afternoon with your grandmother. But what are some things in your life that maybe you haven't identified as physical activity, but that you can see that, oh yeah, I am doing this, and I'm doing this kind of regularly?
My husband and I, about 6 weeks ago, acquired 2 puppies.
Oh yeah.
And the activity level is just, I'm not so much more with them right now.
Absolutely, that's work. Also time and finances, but yes, that is work. That is work. Sure.
I love volunteering, so I feel like somebody should volunteer. Election season's coming up, right? So canvassing, for instance, going door to door. I personally have a personal passion for agriculture, so volunteering at the farm, I'm sure I could get some muscles that way.
Yeah, absolutely. Volunteering, especially doing something in an area that you really enjoy, that you have a passion for. Absolutely. I'll give you other examples too, unless somebody wants to stop me midway. And I'll give you examples that, at least, again, I'm a gerontologist, so related more so to the older population, but that has also been looked at in research. So we're looking at low intensity exercises, so things that are going to give you a steady heart rate, but they're not going to leave you out of breath, so that you can have a conversation while you're doing these activities. Believe it or not, a lot of research looking at strength training. So I'm not telling you to pick up 10-pound dumbbells, but those 2-pound weights or even a 1-pound weight and doing exercises with those. They even have chair exercises where at senior centers, if you have taken a fitness class or not, some of them will have weights for your ankles, so you can do knee raises that are weighted for your ankles, especially if you need to be sitting in a chair. Other things that you can think about, and I took these classes just because I love the water, but swim yoga. Swim yoga is awesome and so much more challenging than you would think. Or even swim, any type of swim aerobic classes. I was the youngest person in our swim aerobic classes when I was going into the Y. Let me tell you, those women, mostly women, there were 2 men, doing laps around me, doing laps, and I'm like, how is this happening? I can't even breathe and I'm in the water. So, things like that, especially if you can find enjoyment in them. Certainly walking if you are able. I will also preface this with, and I'm not a kinesiologist or as a physical therapist, but what we see in the research too is you also don't want to just attempt these things and overexert yourself, right? We want to embrace our aging experience and embrace any type of limitations that we have with them. Not in a negative way, but saying, this is my body now, this is what I want to do to ensure or to help me age more healthily, and so what can I do now that will not cause pain, that will not cause hurt, and what can I perhaps, as I continue to do this, get stronger so I can do more. So I want to caveat that, but before you say, well, Dr. Carl told me to go walking or do swim yoga, I'm not trying to get anyone hurt here. So think about what you are physically able to do now and what you can kind of improve upon as you get stronger. All right, so another area of our biopsychosocial model is psychological factors. I'm really only using this figure because I liked the different categories. So we have social, staying active, managing stress, brain, healthy diet, quality sleep, and meaning and purpose. And when we talk about our psychological factors, if we remember, we're looking at a lot of issues related to mental health, so coping, resiliency, how we respond, in particular how we respond to a crisis. And we've already talked about how physical activity can help a bit of that, right? With depression in particular and cognitive function. But what are some strategies that you might employ when it relates to any of these categories? And I'll give you an example. Some things when you're thinking about brain health, taking advantage of nutrition classes that are offered through senior services, or perhaps your local church, or your senior centers. It doesn't necessarily have to be a senior service agency. It could be your local senior center. When we're talking about sleep, how can we improve sleep? So making sure you have a dim room at night, making sure that you limit any distractions before going to bed. They recommend 20 to 30-ish minutes before going to bed. Limiting any type of exposure to your TV or your phone before you're going to get ready to go to bed. That kind of starts leading you to the process so we can improve sleep. These are also all suggestions if you're not kind of dealing with any other health issues, right? Because we have things like sleep apnea, restless leg syndrome, all of those things that can impact our sleep, but beyond all of those things. So in thinking about, like something we haven't talked about yet is managing your stress. Is there anything that you do already that helps you manage your stress? Walk, exercise, so that all great point here connects back to our biological, but also music, reading, absolutely, I'm sorry? Cooking, yes. Healthy, nutritious meals gets us back to, also connects back to our physical activity.
We learned in one class, we took deep breathing.
Sure.
Change
Yeah, breath work and meditation, absolutely. You in back?
laughter and dancing.
Laughter and dancing, yes. Another tie to music. There are a lot of really interesting research, in particular with music and Alzheimer's disease too, as a way to connect with individuals that have Alzheimer's disease, in particularly in terms of type of dementia. Those are all really great ideas or ways in terms of managing stress. Another one that I liked in here in terms of psychological is meaning and support. And I like this one because although, and admittedly this is an area that I think we could do a lot more work in the field of gerontology, the field of gerontology itself has not explored really in much way at all spirituality. You'll very limited time see that in any research that you do specifically with older adults, unless it's like targeting that plus something else. But I think in finding meaning and purpose and being with you all here today, that could be something too. Like how can we connect to our communities in different ways? We talked about before, somebody mentioned volunteering. So is there meaning and purpose in being affiliated or helping your church in some type of way? Are you going to help with the youth group? Are you going to help with Bible study? Can you find purpose in that way as you age? In particular, for older adults who are facing those transitions, maybe from going from work to retirement, or maybe going from full-time to part-time, and now having a good chunk of your day with not knowing what to do and feeling that that role is missing. Or even in midlife, going from parent to now kids out of the house. What are you now doing? And does a role, we see this affecting women more, but does that role of parent and provider and caregiver change once your children leave the household, and that role that you used to adopt is no longer? So what can you do to find that meaning or purpose in your life? Another one I want to point out when it comes to brain health are brain games. I think that most of the time we think of crossword puzzles, Sudoku, puzzles, all of that, great things. I want to mention to you all another really cool website that is all based on evidence, research evidence, which is called BrainHQ, BrainHQ.com. It is from Posit Science is the organization, and it is a website that you can use on your computer, you can get your tablet. It does cost money, it's about $8 to $14 a month, but there are brain training games on that website that you can do at your leisure. I mean, you're paying for it monthly, so I would say use it, but that you can do at your leisure to help kind of that cognitive stimulation as you age. Were there any other good ones on here? I'm going to save it. Awesome. Okay. All right, and then our last one is support, or the social factors. And so what does the research show us here? So when we think about social factors, we see benefits as we age, and certainly even before then, that having positive social relationships, that is the key. Because not all social relationships benefit us, not all social relationships are positive. But having social relationships that are positive can foster trust, can foster reciprocity, can help us manage stress. There's work out there that shows that individuals with strong social support networks have longer mortality, so they live longer. Lower levels of depression, we even see physical ramifications with lower blood pressure for individuals with these strong social support networks. What I want to acknowledge though here is that our social relationships and who we connect to and who we derive support from changes as we age. So certainly when we're children and adolescents, our major sources of support are our parents or the people who are raising us, however we want to identify or define that. Then as we move into adolescence, young adulthood, that change, the change now happens that we are starting to seek independence. We are trying to now establish our own identity. So the support we are seeking is now through our peers. So we see this a lot more with our own peer group and friendships. As we enter midlife, again, we see a change in role, especially for those, so this is traditionally, for those who then begin to start a family, whether they have a spouse or a partner, then have children. Now the focus is on supporting this kind of new family unit. And then as we get older, we see our support, our main sources of support tend to be with our adult children, grandchildren, and more particularly siblings if we have them. So our relationships change into how we want to get support, how we yearn for support, who we're deriving that support from. And also, as we get older, the number of people that we need in our social networks tends to lessen. However, the quality of those relationships tend to increase. I like to give the example, although maybe outdated now, of Facebook. I got 1,000 Facebook friends, probably. I haven't checked the last time. I would guarantee you 90% of those are people I met in high school or I went to high school with that I have no relationship with now. Don't talk to, don't know, don't say hi to. I don't even give you a happy birthday on Facebook. I'm a terrible person, I know, I'm sorry. But I have no relationship with you. However, if you were looking solely at my social network and just doing a bunch of analysis, it would say I have all of these people in my life. But the quality of those relationships is not there, right? So, but as we get older, we no longer need those big numbers. That we really need a core group of individuals, and what we're getting from those individuals, we can also return, right? It's that reciprocity. So when we're thinking about positive social relationships and how can we foster those, what are things that we can do in our day-to-day that can help us foster these positive social relationships? I got examples, but I'll give it to you guys first.
Calling our friends and family.
Calling friends and families, doing a check-in, doing a checkup. I just was in a panel earlier this morning. I was the moderator, and somebody mentioned being observant to the people around you, to the people in your community. If you're always going to church, if you're always going to the senior center. Oh, you didn't see Sandy today. That's strange. Sandy always comes every Tuesday at 12 o'clock. I didn't see Sandy. I'm not just going to think about it and let it go. I'm going to call someone. I'm going to call someone to call Sandy. I'm going to call Sandy. Someone needs to check on them. That's a great. Any other thoughts?
Sharing a meal.
Sharing a meal, yeah. I mean, it's a very, I think, business thing to do, at least being in my 30s, come have a coffee with me, let's chat about this, that, or the other. I imagine, and I don't know, other than I can base this off of my mother's experience, that tends to decrease a bit when you're not working day to day with somebody, when you're not seeing them day to day. So making it a point to say like, hey, haven't seen you in a while, let's check up, let's share a meal, let's share a drink, let's just chat about whatever's going on in our lives. That's a great one. What other ideas? I got some, given that we are, especially since this is the first time that this conference has been held since 2017, and certainly during COVID, you know, I think that while technology can still be challenging for some of us, the fact that we can have things like FaceTime now, the fact that we can do a WhatsApp phone call, video call, that we can video on Facebook Messenger, that even if you can't get to somebody, they can still see your face. It certainly makes it different, and I will admit that I was a bit of a skeptic initially. I wasn't a big video person, and it makes my interactions with my grandparents so much more different. I prefer to WhatsApp, they are WhatsApp people. I prefer to WhatsApp them video than just talking on the phone. I feel like I have a longer conversation with them. We talk more about more intimate things in both of our lives. And especially in a time where I no longer live in that state, and it's, you know, maybe not the greatest to try to go visit them frequently, given our health situation. Actually seeing somebody face to face and utilizing technology that we have today to do that, I think is a really great step towards establishing and keeping those positive social relationships. Another thing that somebody mentioned earlier in a talk that was in today that I thought was really relevant to this, and also relevant to our psychological health and well-being, is asking for help. I think this can be really difficult. I think this can be really difficult to acknowledge, in particular in my field and for caregivers, to acknowledge that they need help, to acknowledge that they need some type of assistance, and that they're not kind of taking it out on themselves that they need that help. But being able and being aware, self-aware enough to say, hey, I'm struggling. I don't know what I need exactly, but I need something. And so reaching out to someone, and even if that someone you don't think could answer your problem, maybe that person can connect you with somebody else. So thinking about that, and I think this especially helps us combat those feelings of isolation potentially, or the outcomes of isolation. If we can try to remember to reach out for help or get connected with resources. Okay, cool. Any other thoughts? All right, I want to wrap up, and I thought this was really cool because I found this, I promise, I found this after I was done with my presentation. I was like, how can I wrap this up? I want to give some other useful tips that kind of can be in a list form. And this is actually from the National Institutes on Aging. So perfect, fits right in line with my field. And as you'll see here, we talked about, in some way, shape, or form, almost all of these things. And what I liked about this is that the National Institutes of Health page isn't going to tell you about the life course perspective or the biopsychosocial model. But as an educator, I like to set a foundation for, hey, I'm telling you all these things based in something that we know actually happens. I'm telling you that people have done this work, that we're saying if we do these things, or these are how these things relate, And now I'm saying, well, here are some strategies. Not only because the National Institutes of Aging tells you, but then because there's research to back up foundationally, theoretically, why this works, why we can see these connections. I think the only one that we didn't totally talk about are like quitting smoking and alcohol consumption. Those are beyond me. I mean, yes, public health, but I'm not going to get into those things. But they are lifestyle behaviors. And we didn't talk too much about nutrition, but a little bit. So I don't think I put in an end slide, and that is my apologies. But I am going to end this and say thank you so much for coming